Why are parents...
In a minute.
What's happening here with patients not showing up? And this delay is going to really hit, isn't it?
Yes, it is. I mean, this is an interesting study by the Health Foundation, who are a very highly regarded think tank. And it follows in from some work that was done by the Institute of Fiscal Studies a week or two ago. What they've tried to do is to say, OK, we know how many people there are actually on the waiting list now, which is over 5 million. But we know during COVID, people didn't come forward for treatment. And so how many? You know, it's like the Donald Rumsfeld thing. What are the known unknowns? Well, they've done some quite clever modelling with this, and they think they've got a kind of figure that could be running, well, certainly 10 million, and you might be running up to more than that. I mean, there's a kind of a range of scenarios. The problem that comes out of this report, the interesting thing is that the government, to give them their due, have given the NHS 10 billion to fight the backlog, if I can put it like that. But the work of the Health Foundation, it tells us that really, in order to get the numbers down to manageable proportions, and what they're saying by manageable proportions is to get the 18-week standard by 24-25, which is effectively when the next election is, it's going to take 17 billion. So it's almost double the amount of money that the government has come up with. On top of that, the Health Foundation are telling us that the current workforce level is nowhere near enough. We need another 18,000 nurses and 4,500 more doctors. That's if this is going to be cleared up by the next election.
Yeah, and Roy, is the remote healthcare, the way we've been working, I mean, you know, there's nothing we could do. It's the way we've had to deal with things. Has this also made it worse, do you think? Is this to blame?
Look, there's a lot of argy-bargy over this. I think we're talking about appointments with GPs, yeah?
Yeah.
OK, here's briefly the situation. During COVID, GP surgeries were told by the government, don't get people into their surgeries unless it's absolutely urgent, because they're going to become super spreading centres. So the government provided GPs with a piece of software to do stuff remotely, video, as a kind of a FaceTime thing, you know, medical FaceTime thing, which actually worked very well. Since then, of course, we know that a lot of people haven't come forward during COVID. The extent to which that's because people couldn't go and see their GPs personally, we really don't know. Now, the problem GPs have got now is a lot of GP surgeries are quite local, they're quite small. Managing social distancing is very difficult, and they're trying to hang on to the remote consultations. And at the same time, they're saying, look, if you really do need to come and see us, come and see us. But again, there's a backlog, and it's very difficult to get GP appointments. I mean, there's no way of fudging this. People are having trouble getting GP appointments. The whole system really is clogged up.
Well, has your level of where you would go to the GP changed? I mean, in the back of your mind, Roy, what would it take for you to say, I need to see a doctor with this? And is that different from how it was a year ago? Yes, I think so. I'm that sort of age group, really, that just kind of soldiers on, you know, with a fisherman's friend. But I mean, I do understand it. If you're a mum with kids, or if you're elderly and you've got a long-term condition, that kind of thing, then people do. Obviously, they want to go and see their GP. But you get some people who say, well, I don't want to bother the GP because I know they're ever so busy. You get other people who say, look, I've been on the phone for 3 days and I still can't get an appointment. It is very difficult. I mean, I think, the Daily Mail have been running a campaign saying, you know, doctors have got to open up their surgeries, and that's really been very unhelpful, and I think it's quite irresponsible. And Sajid Javid had kind of said, yeah, the Daily Mail's right, and we've got to get GPs to open their surgeries. The GPs are opening their surgeries. They're doing what they can do. I mean, just as a sort of an offshoot of that, it's worth pointing out that in the OECD list of number of physicians per 100,000 population, we're 19 on the list. We just simply don't have enough GPs, and that's part of the problem. This is a very difficult situation. The message is, if you can possibly talk to your GP remotely, please do it. It works much better than you think. But if you can't, well, make an appointment. We're open for business. You know, that's really all we can say.
Well, Hank, yeah, that's fine. I have, in the last week, both my mother and father separately ended up in A&E, and they've both waited more than 5 hours. And when you know that you're facing that sort of wait, and we're talking about elderly people, they come out of hospital in some ways worse than when they went in.
Yeah, listen, A&E waits are horrendous. I mean, again, if the situation is just grinding to a halt, Simon, and the reason is people are coming in, often frail and elderly, often are admitted. When they're admitted, we put them in medical beds. When the medical beds get full, they go into surgical beds. Then we cancel the waiting lists. We want to get people home. Social services, I mean, if you want to talk about what a challenge the NHS is having, you need to have a look at what's happening in social services. They really are in a horrendous mess. They've got no money and no staff. It's taking 6 weeks in some cases to get a care plan together to get someone discharged from hospital. So the system is chock-a-block, and there's no disguising it.
Roy, we have been talking about that for years, literally, haven't we? And this left hand and right hand, and the idea of bringing the NHS and social care together, this is exactly why it needs to happen.
Yes, I couldn't agree more. Now, the government have announced that they will be publishing a white paper sometime soon about the future relationship between health and social care. I mean, I go back a long way to when Frank Dobson was the Labour Secretary of State for Health. And he said, well, you know, it's all about the DOSH and it's all about health and social care working together. Since then, it's been kicked into the long grass. The reasons for that are that social care is means tested and people have to pay for it. Healthcare is free at the point of need and don't. Put those two bits together. How much are you going to pay for and how much is going to be free? That's the difficulty. I do know at the moment, Number 10 is struggling with the draft white paper, trying to bring these you see, if you do a merger, the problem is it takes time, it's hugely distracting, and it costs a lot of money. The simple thing for me, what I would do is to say, right, firstly, change the law so health and social care money can be used by either side. That's a simple thing to do. It's sort of being done now, but it needs to be done properly. And the other thing is about data and access to medical and care records, and that's simple enough by sharing passwords. I mean, there are two things we could do immediately to change that. In the longer run, though, you're right, we need structural change.